Hello class, my name is Wesley Darrow for those of you who don't know. Today I'm going to talk to you about my current event, and the event that I chose to do today was cyber attacks on the Singapore government's health database. So if you want to take a moment, go ahead and pause the video, pull up the PowerPoint slides if you don't already have those up. A little background on my current event. It was posted on July 20th, but the event takes place on June 27th of 2018. Some hackers got into the health database system. They went undetected for about a week, and then on July 4th of 2018, they were noticed, reported to the proper authorities, and then the attack ended. But before they were caught, they were able to retrieve 1.5 million patients' data, and among those, the Prime Minister Lee Hsien Loong, his information was compromised as well. Some of the information that they were able to retrieve dated back as far as May 1st of 2015, and then they got all the way through July 4th of 2018. So of that 1.5 million patients that they were able to get data on, 160,000 of them, including the Prime Minister, they got information on outpatient dispensed medications. So what have they done since the attack has occurred? Well, they're no longer allowing employees to surf the web while at work on work computers. They have increased controls on workstations and servers. And then they've also installed additional monitoring controls on their servers. So that's basically the current event, but what I wanted to talk to you about is a risk analysis. So in my other class that I've taken this summer, we talked in depth about risk analysis, and the other class was HA 5334 for reference. So a risk analysis, why would you conduct one? So it'll help you to identify and prioritize causes of security violations, and so in this case, cyber attacks, but it's not just limited to cyber attacks. I provided some examples on the slides. Some of them can be if you're going to fire an employee, well, you'd probably want to change access codes. You want to make sure that if you gave them a flash drive, you get that flash drive back. You don't want them stealing equipment or tools, depending on what industry you're working in. But it's not just that. It could also be actual attempted attacks such as 9/11. So if the United States government had conducted a risk analysis, could we have possibly put something in place prior rather than after 9/11? And also a risk analysis will help keep the history of cybersecurity violations, like a database that we can compile and we can assess probabilities and things such as that. So I have on the slides how to conduct a risk analysis and the 6 steps. I'll just kind of talk you guys through those. So step 1 is to specify the decisions that need to be made. You want to identify a time frame, and you want to understand the resources that you have available to you, depending on the size of your company and where you're located. Step 2 is you want to maintain a database, and this is important because you want to know, well, what events have occurred, what events are going to occur, and it's just kind of a base to assess probabilities and such, which is step 3 is to assess the probability. Step 4 kind of gets a little more realistic. You want to check the probabilities of events occurring elsewhere and adjust your probability based on that. And then step 5 is probably the most relevant to us, is to assess the similarity of these two events. So the similarity is going to be important because if you're talking about the risk of inflation in the United States and you have a average that includes Venezuela's inflation, well, that's not realistic or relevant to us, and so it's not very helpful. And then step 6, the final step, is to report findings and instructions. And so sometimes when you're conducting a risk analysis, you can be the decision maker or you could be reporting the findings to someone else. And so in summary, I wanted to talk about how this kind of relates to the iron triangle of healthcare. And I think the most relevant facet of it is going to be cost. And so conducting a risk analysis can help with cost in many ways. For example, if you're doing a risk analysis on medication errors and you're able to prevent many medication errors from occurring, well, there's the direct cost of like unnecessary or unneeded medication that you're providing, but also in legal costs. So if your company gets sued because of a wrongful death, this risk analysis helps save quite a bit of money. Also, if there's a contingency and you're doing a risk analysis of the probability of that contingency occurring, well, then risk analysis might tell you that you need to have extra staffing or how to be efficient when bringing on that extra staffing. And so thank you, class. That's all I have for today. Hope you guys enjoy your week.